Injury can strike at any age, it doesn't just happen to older athletes. Being of ages between 14 and 16, your body is going through many physical changes that can increase the risk of injury. Being injured is no fun, and it's highly likely throughout your career you will unfortunately experience injury. But how would you feel if you could aid recovery? Today we would like to introduce you to imagery, an easy way to help yourself. You can use your mind to create a lifelike experience. Using all of the 5 senses, you can see the pitch, smell the fresh air, touch the ball, hear the crowd, and you can taste the oranges at half time. Imagery can be useful in recovery for many different reasons. Some of these are for skill improvement, to motivate, success, decreasing your own negative thoughts, and injury recovery. For skill improvement, you can rehearse your skills so that when it comes to doing them in a game scenario, you are able to perform them more naturally and fluently, therefore increasing chances of success. You can motivate yourself by imagining yourself to score or tackling the opponent at the last moment, show yourself that you can do it. To improve on success, you should see yourself lifting the trophy, celebrating with your friends after winning. An important one is to be able to decrease negative thoughts. Imagine yourself writing those thoughts down, screw up the paper and throw it away. For injury recovery, today's vodcast will be directed towards this. Imagine yourself getting rid of the cast from your broken arm, getting rid of the bandage from your swollen ankle. Imagine the pain disappearing, while healing and rebuilding the area. Listen on to find out how to effectively use this method in injury rehabilitation. The different phases of injury rehab require different imagery techniques. The phases are the early phase, mid phase, and returning to training. The early phase uses relaxing imagery to help you control your pain and swelling. You may experience feelings of sadness and frustration as a result of your injury, and timing your imagery is important to stop these feelings. You should feel the current state of your injury and imagine the pain leaving your body. Remember that training session when you successfully performed that skill, when you dribbled past the defender, or when you scored the winning goal. Hold on to these positive feelings to remind you of what you can do. The mid-phase of rehabilitation should be focused towards visualising the light at the end of the tunnel, increasing your confidence to return to previous performance levels. This should motivate you to adhere to the rehabilitation program given to you by your doctor. Continue to use imagery to rehearse your skills and manage your pain, and you should become more accustomed to using imagery now, and therefore you should be able to use it more frequently on your own, as well as with the rehabilitation exercises. This will keep you in touch with the technical side of your skill performance, remembering how you take a free kick. Remember your posture. You pull your leg back, eyes on the ball. Keep your knees bent as you strike the ball. You arch your back and your leg follows through. If you experience slow progress with your rehabilitation, you may experience anxiety, and here it is vital to continue using imagery to remind you of your final goal and also to remain positive. In the run-up to your return to training and competition, you may experience the fear of re-injury as you begin to re-immerse yourself into your sport. It is important that you see the positive cues from your past performances. For example, imagining your response as the referee blows the whistle at kickoff to provide you with the confidence that this will not happen again. This will bring closure to the injury. It is important to rehearse skills and strategies at the level you did before you were injured. Imagery is no longer used for pain management at this stage. In order to effectively use imagery during sport, and to ensure you image the desired outcome, we can use the PETLEP model. PETLEP is an acronym with different elements of imagery you should consider: physical, environment, task, timing, learning, emotion, and perspective. If you were to prepare taking a penalty kick in the quarter-finals of the League Cup, applying these principles will enhance the performance outcome. The first P is for physical. You can imagine yourself in the kit wearing your football boots. The first E is for emotion. Imagine how you are feeling, the determination to score, to push you through to the next round. If you do this frequently, you will associate these feelings with playing and success. The first T is for task. Concentrate on the corner of the goal you're aiming at. Approach the situation as you normally would. Do not look at the goalkeeper and focus solely upon the ball as you strike. The second T is for timing. Imagine your timing preparation as you approach the ball and execute the shot. Imagine the ball in real time as it passes the keeper. The L in PETLEP is for learning. You can use imagery to learn about a situation. For example, are you predictable? Does your body shape give away where you're going to shoot? And you can teach yourself to change your technique. The second E is for environment. You should focus your attention to imagine standing at the penalty spot. Make it as close as possible to the real life situation. Imagine the noise of the crowd as you approach the ball, and the noise after you strike. The second P is for perspective. When you are doing imagery, it refers to the viewpoint which you take. You can view it internally through your own eyes, or you can view yourself as a third person. This is Ben. Ben is an injured athlete trying to overcome injury. To help Ben, we have prepared him an imagery script so that he can recite this. Here is an example. Focus your attention to your injured ankle. Detect the way it feels and it looks. Concentrate on the swelling and see it getting smaller and smaller back to normal size. As it gets back to normal size, you see the bruising disappearing. Your ankle now feels more normal. The fluid is drained out, you feel it leaving your body. When looking at your injured ankle, imagine a haze of blue light around the area. It is cooling and icing the pain. Imagine your ligaments and surrounding muscles getting stronger. They all come together in a slow, strong fashion. You feel all the fibres in your ankle growing and getting tighter. Look at the muscles around your ankle. Try to relax them and allow them to feel loose. Feel your calf being massaged and the knots of stress being kneaded out. Notice how your ankle feels stronger, together and relaxed. Concentrate on the feeling of strength and you're getting better. Enjoy that feeling of relief. So to summarise this vodcast, imagery should be used for skill rehearsal and pain management. Secondly, when imagery is used correctly, it can be useful in each stage of rehabilitation. Using all 5 senses will help to make imagery more effective, and using the PEP method can also make imagery more effective too. Try to stay positive, and if you struggle to do so, then imagine yourself being successful. And always remember, imagery is an easy way to help yourself.